Hello everyone, welcome back to my YouTube channel Pharma Achievers. Let's continue the topic about suspension. In the classification of suspension, it can be asked for 5 marks, in which the suspension it is broadly classified as oral suspension, parenteral suspension, ophthalmic suspension, suspension for external use. First, let us see the terms. Oral suspension means which are consumed by the oral route as syrup. Parenteral suspension means parenteral means uh, for Bpharm first sem, the meaning of parenteral is parenteral. Enteral means intestine. Parenteral means bifurcating or other than the intestine route. Other than the intestine route in which directly it is given through the topical route through the injection. Intramuscular, subcutaneous, intravenous injections. It is parenteral route. Ophthalmic suspension means which are instilled into the eye cavity. Suspension for external use means either for the topical use over the skin. In case of the oral suspension, these are the suspension which is consumed by the patient by the oral route containing generally flavoring agent and sweetening agent to mask the bitter taste of drug. See, some of the drugs may have bitter taste, some of the drugs will be neutral in taste, some may be alkaline, some may be metallic, some may be sweet also. Initially, the bitter taste of the drug, we have to mask. Mask means cover the bitter taste and make it neutral so that the patient compliance can be increased. Patient compliance means patient acceptance. For masking the bitter taste, either we can go for the addition of sweetening agent and flavoring agent. Example for oral suspension is chloramphenicol suspension. Nowadays, suspensions are available as dry powders which can be reconstituted by addition of specified quantity of freshly boiled and cooled water. Example, antibiotic suspension. See, as I said, the suspension it has the disadvantages of the physical stability and the sedimentation problems. To overcome that, easily reconstitutable powdered form of suspension are available in market. Similarly to the dusting powder or talcum powder, these suspensions are prepared in form of powder and it should be reconstituted. Reconstituted means re-prepared by adding up of the freshly boiled and cooled water and shaken well and it can be easily consumed. Properties of the oral suspension are it should be attractive. See, if it is not having the good color or good appearance, the patient will not consume. It should be uniform in color and appearance and consistency. It should be swallowed easily and should have the good taste and odor. Patient will accept when it is having the good taste because palatability should be increased. Consumption should be accepted. So it should have the good taste and odor. Should be perfect, should have the perfect viscosity. See, optimum viscosity should be there. It should not be too viscous or it should not be less viscous like a water also it should not be there. It should be having the proper viscosity so that it can be poured into the container and can be easily consumed. Advantages of the oral suspension. It is easily to swallow. The insoluble derivatives in the suspension is more palatable than the soluble derivatives in solution. See, some of the drugs characteristics or stability it is increased in case of suspension than the solution. The bulky powders like the kaolin charc can be administered in suspension, so it acts as adsorbents of the toxins and reduces acidity in the GIT. Along with the suspension, kaolin or chalk it can be added. These are the bulky powders in which it will reduce the acidity in GIT. It will absorbing up of the toxins. These were the advantages of the oral suspension. Let's see about the disadvantages of the oral suspension. All the suspensions are required to be shaken before measuring a dose. See, whenever the patient consumes the suspension, it should be shaken and reconstituted and consumed. Accuracy of dose is less reliable. Whatever might be the dosage form, whether it may be solution or maybe suspension or the emulsion. See, accurate dosing is not possible. Exact 5 ml the common person or the patient cannot take, because first of all the patient will be having some disease. In the diseased state, it is very difficult to judge the accurate dose. Every person or every common man cannot have the measuring cylinder with him. So, accurate dosing is not possible in this case. The storage will lead to the change in the dispersed system when there is fluctuations in temperature. See, suspensions should not be freezed or it should not be kept in the high temperatures, because fluctuation in the temperature, alteration in the temperature will lead to the changing in the dispersibility of the solid particles in the solvent. This was about the oral suspension. Some of the drugs will be having the instability in case of oral suspension. That is, example, penicillin. It will get degraded in the stomach. So we are going for the parenteral route. See, one problem, if it is there, hundred of solutions will be there. So we have to think about the solution. One problem in the dosage form, we have to change, just to change the dosage form or change the properties of the drug. The solution will be there, just we have to find out. In case of the parenteral suspension, it is administered by parenteral route. Parenteral route with the help of the injection. See, for performing or formulating up of the parenteral suspension, it should have the following characteristics. That is, the particle size of the drug should be such that it can easily pass through the needle of the syringe, that is called as syringeability. You saw the in the marketed product, in the actually it is not given for the patients directly. The doctors usually perform the injection process, in which if you see the injection bottle or injection ampule, it is called as, in which the drug particles will not be seen. It is a crystal clear solution which is not having any visible particles or any sediment, anything, just like the pure water it will be there. In that case, in which the particle size of the drug, it should be very less, as it should enter into the needle of the syringe. The syringe of the different numbers are available, in which different needle sizes are available, in which the solution can be taken into the syringe. It is called as syringeability. There should not be any crystal growth upon the storage. See, in the case of parenteral, we are usually giving through the injection. If there is a crystal growth, it makes it difficult for taking into the injection and administering into the skin surface. So there should not be any crystal growth. The concentration of the solid particles should be in between 0.5 to 30% only. 0.5 to 30% the concentration of solid particles in case of the parenteral suspension. The viscosity should not resist the flow of suspension from the syringe needle. After taking into the syringe, there should not be any resistance to flow into the body of the patient. The viscosity should be proper. They should be sterilized. Sterilized means free from the bacteria, molds, virus, anything. They should be sterile in nature, so that there are not any infections in the patient. See, I was saying here that there should not, it should be crystal clear like that. Few of the injectables are crystal clear like the pure water. But in this case suspension, the solid particles will be there. But it should be there in the concentration of 0.5 to 30%. And there should not resist to the flow of the suspension out of the injection or inside the injection. And they should easily pass through the syringe. That is the point I am going to say. Next, ophthalmic suspension. They are not commonly used as eye drops. See, ophthalmic preparations, most preferred type of the ophthalmic preparation is eye drop. Eye drops means for 100%, 90% of the cases eye drops are prepared. When the eye drops cannot be prepared for particular drug, for example, if you take paracetamol, I am taking example, when you can't prepare the ophthalmic eye drop for the paracetamol, you can think of the different dosage form like suspension or emulsion, like that. They are prepared only in case when the drug is insoluble in the desired solvent or unstable in the liquid form. Unstable in liquid form and insoluble in desired solvent. In two cases only, these are prepared in form of the ophthalmic suspension. The qualities that it should have are, the particle size should be fine, as it should not irritate the eye. This is the major point you have to consider while formulating up of the ophthalmic formulations. Because when you see the eye drops, when you instill the eye drops into your eye, you will not feel any irritation because it is the crystal clear solution which do not contain any solid particles. You will not get irritation. See, for example, when a particle of the dust or small stone particle, anything will go into your eye, how much uncomfortable or how much irritation you feel. That is the case you have to consider. For example, if you formulate a formulation, eye suspension or the eye drop in which the particle size is very big, it is very having the grittiness, then it will cause us the irritation of the eye, then it damages the eye mucosa, then conjunctivitis, iris, pupil, anything may get damaged. So it should not irritate the eye. The particle size should be very fine in size. They should be sterilized because directly it is coming in contact with the blood vessels of the eye. Hence, the preparation should be sterile in nature. They should be isotonic or pH should be adjustable. Isotonic means it should be having the same tonicity of the eye. If it is either hypotonic or hypertonic, then there may be causes of the swelling of the eye or depression of the either decrease in the size of the eye. It should not happen. And pH of the eye, it should match with our ophthalmic preparation. They should have the desired viscosity. They should have packed in the suitable container so that they can be easily instilled into eye. See, all the different the dosage form will be having the different container. For tablet, it will be given in the aluminum covered, this one, tablet films, and the solution, it will be given in case of the bottles, amber colored bottles, syrups, solutions will be given in amber colored bottles, and these eye drops will be given in the special container so that only one drop or two drop it will fall into the eye once at a time. Like that the container it is manufactured. Next, suspensions for the external use. Example, lotion, inhalation, ear drop. Lotions for applying to the skin surface, inhalation for inhaling, inhalations generally given through the nasal route, for inhaling through the nasal route, and ear drops which are administered into the ear. They contain smaller particles to avoid the grittiness, similar to that of the eye preparation as I said. The solvent in the suspension evaporate from the skin surface, leaving a light deposit of medicament on the surface. Lotions or these ointments, when it is applied over the skin surface, the solvent it will get evaporated. Only the drug medicament layer it is left on the skin surface. They are applied to provide the protective effect to the skin surface. These are the suspensions for the external use. Suspensions are required to fulfill the following qualities, that is pH should be adjustable, should be easily applied. See, if it is having the frictional force is acting means it cannot be easily applied. So there should not be any grittiness, like that it can be easily applied then. Particle size should be small to avoid the irritation. It should be free from the microorganisms. It should be sterile in nature. See, first of all, we are giving for the treatment of particular disease. If there is a microbes means microorganism, then there is a chance of the another infection may occur to the patient. See, when you are giving treatment for particular disease, the main concept should be in our mind is treating a particular disease, avoid the occurrence of the other disease. See, if it is not sterile, if the microorganisms are there, then other bacterial infection or viral infection is occurring means the medicament or the medication which are giving becomes useless. So we have to keep in mind that the suspensions for the topical use or ophthalmic use or parenteral use, it should be free from microorganisms. Next is the flocculated and deflocculated suspension. Flocculated suspension. A suspension is said to be flocculated when the individual particles are in contact with each other and form a network-like structure. I said in this, the drug particles will be dispersed into the solvent. When one particle is in contact with another particle, the chain will form, the network will form. That is called as flocculated suspension. See, in case of the flocculated suspension, the rate of sedimentation will be high. The network formation will be there, the sedimentation will be high. And it is loosely packed and can redisperse easily upon shaking and form the original suspension. See, the bonds that are formed are weaker bonds to form the network. When it is shaken, the bonds are broken down and it is easily redispersed in the solvent. They must not be elegant because they are difficult to remove from the bottles and vials. And while transferring floccules remain sticking to the sides of the bottle. These properties can be improved by adding up of the protective colloids. Coming to the deflocculated suspension, here the individual particle exists as a separate entities. I said in flocculated, flocculation means network formation. One will be in contact with another to form a chain-like or network-like structure. It is called as flocculated. But in case of deflocculated, each particle will be different entity, separate entity. Here, the rate of sedimentation will be low because each will be having different energies, and the sedimentation rate will be very low, and sediment is formed slowly but sediment is closely packed. Here the rate of sedimentation is slow, but once the sediment it is formed, it is very difficult for redispersing or shaking. Hard cake is formed when it is difficult to redisperse to get the original form. As I said, rate of sedimentation means movement to the bottom of the bottle. It is slow, but once it goes and settles in the bottom, it will form the hard cake. And upon shaking number of times, it is very difficult to redisperse. They have pleasing appearance as compared to flocculated suspension. See, for while when you keep in the transparent bottle, flocculated and deflocculated, flocculated suspension will be having pleasing appearance or attractive appearance than that of the deflocculated suspension. This was about the types of the suspension. Another question may come for 5 marks or 2 marks. Write the differences between the flocculated and deflocculated suspension. Then you have to make the 2 columns and you have to write the number of the differences. In case of flocculated, as I said, the particles, it will form the loose aggregate and form the network like structure. But in case of deflocculated, I said the particles which will exist in the different entities or separate entities. Individual particles can be seen in case of deflocculated suspension. In flocculated, rate of sedimentation is high, and in case of deflocculated, rate of sedimentation is low. In case of flocculated, sediment is rapidly formed, and in deflocculated, sediment is slowly formed. In case of flocculated, easily to disperse, loosely packed and do not form hard cake. Supernatant liquid is clear. Other than the network or chain structure, the entire solvent is clear in nature. But in case of the deflocculated, the sediment it is slowly formed, it will form the hard cake, difficult to redisperse. Supernatant liquid, it is not clear because individual particles will be there and it will be having solvent around it. So the supernatant liquid, it is not clear. Floccules stick to the sides of the bottle in case of the flocculated. Network, I said network or chain, in that case it will adhere to the sides of the bottle. But in case of the deflocculated, in which it will not adhere to the sides of the bottle. In case of flocculated, it will not have the pleasing appearance. In case of deflocculated, it will be having the pleasing appearance. These points you can give for the difference between flocculated and deflocculated. In the next video, we will be going to discuss about the preparation of the suspension. What are the different methods to prepare the suspension? And in the upcoming videos, we are going to see stability problems related to the suspension and method of dispensing of suspension. Thank you all. Thank you so much.